which I have had over 50 that I participated from A to Z. This is about the 50th or 55th or so. And what Nico said about the Hotel California is really true. You made the decision to enter this club when you signed up for this education week. This is not advertised beforehand, but you just become part of it, and you can't help it. You can never leave. You have hopefully also gotten a twist in your mind of what implants are all about. That's why we call it implant dentistry and not implantology. It is dentistry in true sense with implants or without. Both ways of treatment are in our daily program. It is funny when we try to find out what is the attitude of the dentist to place implants. I mean, who jumps to the forceps the first? When I was still here, my wife had done a thesis on that. And she has looked at questionnaires with scenarios that were sent to all the MDS students in implant dentistry, which were about 30 or 40 at that time, who had had a 3-year training in implant dentistry. So these were the highest educated people. Then the second group were students or former students who had some kind of implant dentistry experience and some training at the university. And the third group were those who have gotten their knowledge for implant dentistry in weekend courses offered by any company. So you have 3 levels of education, and you know who was the most careful. In other words, those who did recommended implant treatment the least, these were the highest educated ones. In other words, you get on your way to evaluate the risks more and more, and through that you become careful, and when you use them as a blessing in a strategic way. And this is what we try to convey to you, that implants are here to stay, but they're not a self-purpose. The philosophy of make space for titanium, MST, that philosophy is not our philosophy. We use implants where it is reasonable, where it is the best biological way and serves the patient the best. And you have seen in the cases that we have presented these days, that normally there were not 15 implants there. There was 1, there was 2, there were 3, maybe once 5, but it is not a matter of placing as much hardware as possible. You're going to be the successful dentist when you use implants in a strategic way, not just to make money. We know we can make immediate money with implants. The presentation by the Dean was fantastic in that way. We can do that. But is that what you want to be as a doctor? I don't think so. That's why you came to this course without knowing it. So I wish you a lot of satisfaction in your professional and private life, and hope you remember this course in the best, and that we will meet soon. That's it. You can check out, but you can never leave. Okay. Thanks for having been here, so attentive for the roughly 40 hours of intensive treatment. You will not do that every day or every year. This was a unique opportunity that you chose to come, and you made a difference in your life through that. Thank you very much.